and modify. Stop, drop it low, but pick it up carefully. Work them glutes like you in physical therapy.
Muscle of the thorax, which is forming the valves of the thoracic cavity. These muscles involve the intercostal group, the diaphragm, the levator costrum, the serratus group, the transverse thoracis, and suboccipital pectoralis group. First of all, we will study about the intercostal groups, which are the typical muscles. Okay, the group of muscle which cover the ribs, they are three in numbers: external intercostal muscle, internal intercostal muscle, and the innermost intercostal muscle. The first external intercostal muscle is the external muscle which is found externally towards near to the skin after the membranous fascia. It is the outermost layer of the ribs muscle, and its fibers are directed downward and forward. Its section is actually the stabilization, rising and the rising of the ribs during inspiration, and thus it increase the intrathoracic pressure. As you can see, this is the external costal muscle, the left external intercostal muscle, in which the fibers are directed downward and forward. The internal intercostal muscle is the muscle which is found after the external intercostal muscle, and its fibers are directed downward and backward, as you can see in this image. Its section is basically depression of the ribs during expiration, while the external intercostal muscle having the function of the inspiration and increasing the diameter. But it's opposite to the external intercostal muscle. The innermost intercostal muscle is basically a very thin layer of muscle. Its function is its section is just to assess the external and internal intercostal muscles. These muscles are having some common features, which are the origin of these external intercostal muscle, internal intercostal muscle, and innermost intercostal muscles are from the inferior border of the ribs, and it attach superiorly near to the superior border of the another ribs. Nerve supply are from the intercostal nerves, and the blood supply are the intercostal artery. Now, diaphragm is the muscle which divide the various organs or thoracic cavity into the abdominal cavity, which is having the origin from the xiphoid process, lower 6 costal cartilage, and first 3 vertebrae, like you can observe it here. This is lower 6 intercostal cartilage, the xiphoid process, and the third number vertebrae. Okay, then it is inserted into the central tendon, which is found here. It is a central tendon. Okay, the nerve supply of this muscle is centrally it is innervated by the phrenic nerve, and laterally it is innervated by the intercostal nerves. Blood supply is the superior and inferior phrenic, musculophrenic, and the intercostal artery. Its section is in the inspiration, assist raising in the lower ribs, also used abdominal straining and weightlifting. During weightlifting, levator costrum is basically among the spinal muscles, but we will discuss it here because it is having a very crucial role in the inspiration. Okay, so it originates from the transverse process of the C7 to T11 vertebrae, and it insert on the rib below to the transverse process. Its nerve supply is from posterior rami of the spinal nerves. Its section is actually the elevation of the ribs. Serratus group, serratus muscles are those muscles which found anteriorly and posteriorly. They are it involves the serratus anterior, serratus posterior superior, serratus posterior inferior. Okay, these are the serratus posterior superior and posterior inferior. Serratus posterior inferior originate from the T11 to T12, and it insert on the 9 to 12 thoracic ribs, while its section is a depression of the ribs as it acts the expiratory muscle, because it is found on the inferior the side, that's why it depresses the ribs. While in opposite, the serratus posterior superior is a muscle which originates from the C7 to T3 spinous process of C7 to T3 the vertebrae, and it insert on the superior border of the 2 to 5 ribs. Its section is the inspiration or raises the ribs because it is found on the superior part of the thorax. Serratus posterior inferior and posterior superior having the common nerve supply from the intercostal nerves. Serratus posterior group is having common nerve supply. Serratus, it is having nerve supply from 2 to 5th, 9 to 12th thoracic, intercostal and subcostal nerves, because 12 thoracic nerve is the subcostal nerve, it's not the intercostal nerve. Blood supply is also the same. Serratus anterior, okay, the serratus anterior is a muscle which originates from 1st to 10th rib, and it is inserted on the posterior angle of the scapula and the medial border of the scapula and posterior inferior angle of the scapula. It is high, remember this, his innervation of this muscle by the salt, because serratus anterior long thoracic nerve. That's how I remember its nerve supply. Okay, its blood supply is from the superior and lateral thoracic arteries and thoracodorsal arteries, and its function is to draw the scapula anteriorly, suspend scapula on thoracic wall, rotate scapula inferiorly or angle laterally, and it is also forming the scapulothoracic joint. It also stabilizes the scapula. Okay, pectoral group are having two major muscles, pectoral major and pectoral minor. These muscles are found on the anterior part of the thorax, like you can see here. The chest muscle, which is also called the pectoral major originate from the 1/3 of the clavicle area and the sternal area, and also from the costal cartilage of the 1st to 6th ribs, and it insert on the crest of the greater tubercle of the humerus. Its section is basically the horizontal adduction and arm internal rotation or arm flexion and arm extension. Okay, it is innervated by the lateral and medial pectoral nerve, and blood supply is also on the same nomenclature. Pectoral minor is a small muscle. It originates from the 3 to 5 ribs, and it insert on the coracoid process of the scapula, and it is innervated by the medial and lateral pectoral nerve. Blood supply of the pectoral minor is from thoracoacromial, pectoral and deltoid branches and superior thoracic and lateral thoracic artery. Its function is to form the scapulothoracic joint, draw the scapula anteriorly, inferiorly, and stabilize scapula of the thoracic wall. Subcostalis muscle is a muscle which is found inside the thoracic cage, and it is originated from the internal surface of the ribs near the angle of the ribs, and it insert on the ribs 2 to 3rd level below from the origination. Its action is the depression depresses the ribs forcefully or forceful expiration, and it also support the intercostal muscles and spaces and thoracic cage. It is innervated by the intercostal nerve. Blood supply of the subcostalis muscle is from the posterior intercostal artery and musculophrenic artery. Transversus thoracis is the next muscle having the origin from the lower third aspect of the sternum and lower 3 costal cartilages, costosternal junctions, and it insert on the 2nd to 6th costal cartilage of the thoracic cage, and its function is to depresses the ribs, and it is innervated by the muscular collateral branches of the intercostal nerves.